Hi, this is Dr. Hufstader, and today I wanted to talk to you about type 2 diabetes. It was probably a month and a half ago. I was sitting in an outpatient blood lab in the waiting room, and I happened to look up in the corner at a television they had up in the corner, and the television was running a loop of ads and sort of educational entertainment there in the waiting room. And an endocrinologist was going to come on in a minute and talk about type 2 diabetes. And she laid the groundwork for her, whatever she was going to say, by giving her credentials and her sort of experience in this field, by saying, hi, I'm Dr. Such and Such, and I've been helping manage Mr. Brown's diabetes for the last 10 years. And right away, what came to my mind, and I don't know if it came to anybody else's mind there in the waiting room, but what came to my mind is, well, doctor, if you've been helping manage Mr. Brown's diabetes for the last 10 years, why is Mr. Brown still a diabetic? We know that diabetes, of all the diseases in the United States, and by the way, about 1 out of every 4 people in the United States now is diabetic or is heading toward diabetes, one of the great scourges, a bona fide epidemic in the United States. But almost 100% curable. A diabetic doesn't have to be, quote unquote, managed for 10 years. A diabetic can become not diabetic in much shorter time than that. And the reason why this doesn't happen more often is because there's a great misapprehension about what it is that causes diabetes. Most physicians misunderstand the fundamental endocrinology and biochemistry of diabetes, and they mistakenly believe that diabetes is a problem with elevated blood sugar. No question about it. A type 2 diabetic will have elevated blood sugar. There's no question about that. That's the way it's diagnosed. That's the way you find it. But the elevated blood sugar is not the problem. The elevated blood sugar is a symptom of a more fundamental underlying endocrine disorder. And that disorder is a problem with chronically elevated levels of insulin and leptin, but primarily we're talking about the hormone insulin. And what happens is insulin levels elevate for years on end. And the cells, particularly the skeletal muscle cells, begin to lose their sensitivity to insulin because it's been elevated for so long. It's a negative feedback loop that you have throughout your body. Every time a hormone elevates beyond a certain range, the cells that are supposed to respond to that hormone reduce their sensitivity to that hormone. And what happens for diabetics is that because the skeletal muscles have lost their sensitivity to insulin, insulin elevates even more. And the sensitivity becomes even lower, and it elevates again more. So you have this sort of vicious cycle of elevating insulin and low sensitivity to insulin. And the job of insulin, of course, is to move sugar into the cell where it can be used as fuel. So when insulin can't do its job, sugar accumulates in the blood. But sugar in the blood is not the problem, and just treating the sugar in the blood, just using medications, for instance, to move sugar out of the blood, doesn't do anything about the problem. And the problem is elevated levels of insulin. And sadly, what some medical doctors still do, I can't imagine how it's possible, but some of them still do prescribe insulin to type 2 diabetics, which is the worst thing that you can do. I'm certain that within the next decade, prescribing insulin to a type 2 diabetic will be considered medical malpractice. It's done widely now, shockingly, but it's done widely now. It's taking a bad problem and making it worse just to get sugar out of the blood. So how do you reduce the levels of insulin in the blood and increase the affinity for insulin in the cells, particularly the skeletal muscle cells in the liver? Number one, the patient has to go on a controlled low carbohydrate diet. This is critical. given the fact that high fructose corn syrup is the #1 source of calories in the United States. I know it's hard to believe, but it's true. It's not a surprise that we have such a problem with insulin, high insulin levels in the blood. Removing all soda from the diet, removing all fruit juices from the diet, not eating grains, and having a relatively low carbohydrate diet. And it depends on the person, and I'm not going to give too many sort of generalities here in terms of how much carbohydrate, but suffice it to say that everybody, every diabetic, will be on a reduced carbohydrate diet and probably no grains in the diet. So the diet will be composed of high-quality proteins, high-quality fats, vegetables, and a few very low glycemic index fruits, like berries, for instance. That's #1, low carbohydrate diet. This patient will probably have some sugar cravings. There's not much doubt about that. And those sugar cravings are controlled through some important supplements. Vitamin, mineral, and herbal supplements. And we have a protocol that we use in this office that includes a handful of things, which are all designed to increase the affinity for insulin on the skeletal muscle and the liver, but mostly the skeletal muscle. That's very important to help to control those sugar cravings, which will diminish in time. But initially, there's some pretty powerful sugar cravings. If you are one of these people who deals with really intense sugar cravings, try the B vitamin in inositol and just use it. Get inositol tablets and just use it as like a hard candy. And you can eat up to 8 or 9 grams of inositol a day, but just get little tablets. And if you feel a sugar craving, just suck on some inositol. It's a sweet B vitamin, and it in fact does diminish some of those sugar cravings. And then finally, exercise. All type 2 diabetics, if they want to lifestyle their way out of the disease, have to exercise. And I'm not talking about light exercise here either. It's pretty intense exercise. So you want to do mostly anaerobic type exercises that you shouldn't be able to carry on a conversation with somebody while you're doing these exercises. Let's put it that way. Anything that causes you to feel the burn is the exercises you want to do as a type 2 diabetic. So stair climbing, weightlifting, things like that. If the horrors of having a reduced carbohydrate diet, taking a few supplements, and exercising on a regular basis are just too much for you, then you can continue to use drugs and inject yourself with insulin. But if you are willing to do what's required to change your life, you do not have to be a diabetic any longer. And it certainly takes less than 10 years to get yourself out of the problem of type 2 diabetes. So I hope this was helpful to you. I enjoy doing these, and I truly appreciate you listening to it, and I'll see you again sometime soon. Thanks.